Hi, it's Jenny and Friends with Steve Marshall, and we are here today for our Health Tidbits with Dr. Kohli. Now, if you have not seen her on 9 News, Dr. Kohli is a Harvard-educated general and preventative cardiologist. It's Cherry Creek Heart in Aurora, right?
That's right.
And you're also an associate professor at Johns Hopkins University and Duke University. So all the things my mother wanted me to be, that's you. Like every single tiny one.
Thanks. My self-esteem just dropped like 3 points.
I was like, well, you know what? I made a joke today about having to cook Thanksgiving dinner. So that's, I've got that going for me too. It's great. No, Dr. Kohli, we love you. Thank you so much for coming on. One of the things we wanted to talk to you about today is like how to protect your gut health during Thanksgiving, because we all know it's like one of the busiest eating days of the year.
You know, it really is. I love Thanksgiving because it's a holiday where we sit down, spend time with friends and family. We pause and we give thanks. So it's just the idea of Thanksgiving I love. But if you think about your gut, it's about to run a little marathon on Thanksgiving. And if you were running a marathon, would you do it without training? Never,
no.
Right? And so
point.
think about sort of training your gut the few days before Thanksgiving and the morning of Thanksgiving as well by planning what you eat and what you do. So a lot of times people think they should skip breakfast or skip lunch because they're about to eat a lot of calories in the evening. It's actually bad to do that. So what I would suggest is eating a very light, easy to digest breakfast and lunch. So something like a, fruit smoothie or yogurt parfait or, a salad with some berries and nuts on it. Something that keeps you energized, doesn't make you super hungry in time for dinner, but at the same time is not super difficult to digest.
And is it better to eat slower too, like when you're at the table?
Yes. So at dinner, one of the best things you can do is I call it mindful eating. And it actually comes from Japanese medicine and from Indian medicine, where you're supposed to stop eating when you're 80% full. So you're supposed to eat very slowly and actually savor what's in your mouth. But you can imagine when we're at the Thanksgiving table, we're talking, we're laughing, we're socializing, and that takes away from us actually feeling our satiety signal in our brain. Mm-hmm. So every, few minutes, you just kind of want to do a little bit of I call it a gut check and a brain check. Am I full yet? Mm-hmm. Am I still hungry? And you're not just eating everything on your plate because it's on your plate, but you're actually savoring the taste and texture and also sort of responding to your eaten cues. Now, it takes about 20 to 30 minutes for the full signal to hit our brain. So if you eat until you're full, by definition, you've overeaten. So what I do is, again, stop at that sort of 80% when I'm still like, I think I want a little bit more. Wait, talk a little, chat a little, socialize, maybe have your wine, and then kind of recheck in about 20, 30 minutes later with your gut and say, okay, am I full now?
I'm glad you said that because that's always my problem is I eat and then I'm full. And then another 20 minutes goes by and I'm like, oh my gosh,
full.
I can't even
The
survive.
buttons like popping off your pants.
Seriously,
You're like,
it's so
maybe
bad.
went a little too far.
Yeah.
A little too hard in the stuffing. A little too hard.
The other thing I like to do is between sort of your appetizers and drinks when you first get there and your dinner, or between dinner and dessert, if there's a way to incorporate any activity, because that actually helps to make the body metabolize your food better. So let's say you eat something and it makes your blood sugar spike, but you walk around a little bit when you eat it, it's going to decrease that blood sugar spike. Okay. So especially if you're someone like me, and I love desserts. Mm-hmm. And so between dinner and dessert, because I know I'm going to eat a lot of desserts, I try to do something, even if it's just standing or just walking around the house. Mm-hmm. Or the living room's cold outside, so it's hard to go outside for a walk. But a few minutes on the treadmill or just walking around the living room or standing, all of that helps to kind of burn more calories than just sitting on the sofa and turning on the TV.
Well, I always end up getting stuck with the dishes, so I'm definitely standing for hours.
There's some athletic
I feel
activity
like there's
going on.
always like in the family, there's like that one cousin that doesn't do it, and then there's the one that's like, oh, okay, yeah, I guess I'll just do all these dishes. That's great. Thanks so much.
And I have some in my family who pretend like they're helping, but don't actually help.
They come in for the very last part. And they're like, man, we did a good job.
Look at us knocking that out.
You're on notice, Steve.
I will help you with dishes. I don't mind doing dishes, so I'll totally help you.
So also, like you had kind of talked about having a drink in between. What are some things that you should drink in between to help?
Yeah. So one thing I want us to be mindful of, because it's always nice to have a glass of wine, but that's a lot of liquid calories, right? Mm-hmm. And a lot of sugar as well. So what I like to tell people is if you're going to drink alcohol, see if you can alternate alcoholic and non-alcoholic, sort of back and forth. So it gives your body a little time to adjust the dose of alcohol, again, so that it doesn't all hit you later. And then you're like, oops, I can't drive home. Or, I think I drank a little bit more than I should.
I have a cousin like that too.
Right?
Yeah. I Have you been to my Christmas? Have you been to my
You know my family?
Yeah.
And then try to drink a lot of water in between. So water does two things. One, it makes us fuller. So it makes us consume fewer calories. Second, it metabolizes the food better when you're more hydrated. And third, then it dissolves out sort of that alcohol and helps with any kind of hangover, whether it's the carb hangover, the wine hangover, all the hangovers that we get after we have a nice big Thanksgiving meal.
That carb hangover.
Carb hangover.
Dude,
Oh, yeah.
I'm getting ready for that one.
Well, and it's funny because people think it's the tryptophan in the turkey.
Yeah.
But it's not. It's the carbs.
Yep.
It's really the carb load that makes us get that sort of sleepy
Yeah, because we
feeling.
talked about that this morning on the show where it was like, no, it's not the tryptophan. Quit blaming the turkey. It's not its fault.
Carbs turn to sugar, basically, right?
They do.
In
exactly.
the system. And then, so it's kind of like getting a sugar rush and then you have a sugar crash.
That's exactly right. And you think about it not just for us, but for our kids. And if you look at America as a whole, there about 38% of us are pre-diabetic and about 11% are diabetic. So there's about half of us that are either pre-diabetic or diabetic. So if you think about your Thanksgiving guest list, half the people there have trouble with their body processing sugar. So you really also want to be mindful of the types of foods you put on the table when you're kind of preparing meals for these types of guests. So there's something called a glycemic index, which means how does our body react to certain foods. So if I eat a cookie, it has a high glycemic index, my sugar is going to spike way up. On the other hand, if I eat a spinach salad with berries on it, of course that has some sugar in it too, but it's much slower spike in our glucose. So Google low glycemic index foods, and those are the ones you really want to try to enrich on your table. And it's a lot of like whole grains and berries and spinach, kale, those types of things.
So not stovetop? Dang it.
Maybe it's just like
I was
one
hoping for
little
some good news.
One little spoon of stovetop. Like, because I love their stuffing too.
Yeah.
But here's what I told my mom. She's hosting this year. I said, try to put smaller plates on the table. Because
great
if you
idea.
have a bigger plate, and generally dinner plates tend to be bigger, but if it's bigger, we tend to fill it up. And then we tend to eat everything that's on our plate. So if you have a smaller plate on the table, it actually subliminally makes us take a little bit less food out of our big family style meal as well.
I like that.
Yeah, because I like to try everything.
Yeah.
So I want like one spoon of stovetop
Yes.
on my plate.
Yeah.
But it's nice to have a little stovetop
It
stuff.
is. Oh my God, it's so good. He's giving me a hard time. I'm like, yeah. I'm most looking forward to stuffing. I don't know why, but I really.
Well, you
totally
know
am.
what else I've told a lot of my friends and patients, actually some of my colleagues too, is this, something called a continuous glucose monitor. I don't know if you guys know these, but as the holidays are approaching, if you're thinking about fun gift ideas for family members, especially if they struggle with sugar or high blood pressure or a lot of cardiac risk factors, you can self-order these online. They're about $100 a month. It's a little sticker you put on your arm, and it gives you an instant notification of your sugar after every meal all through the day. It's called a continuous glucose monitor.
Nice.
So you get a lot of information about how your body responds to the foods that you're eating so that you can really try to adjust that.
Interesting.
I know, that's super cool.
Yeah.
So guess what you're getting with Thanksgiving dinner? You are so lucky. Yay! Well, thank you so much. Again, Dr. Kohli, if you see her, she's a 9 News medical expert. And your practice, Cherry Creek Heart and Aurora, you are accepting new patients right
I
now,
am,
right?
yes.
So make an appointment, maybe discuss your heart health and how to basically do like optimal strategies to help make you healthier.